Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers. This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
I just had the privilege of meeting with Lucas Rockwood, and again, I'm venturing out into different spaces. I've had a meditation teacher on, I've had a rabbi, psychologist on, and now I've stumbled upon Lucas Rockwood, and he came to me because in the beginning of the pandemic, during the quarantine, I was having such a hard time walking, and somebody in the know told me about, hey, I'm doing this hip challenge, and I thought, oh, that's cute. The guy's in Barcelona. He set up a little camera, and it turns out that Lucas Rockwood has a whole following and has a whole journey of his own, from drugs and alcohol to yoga teacher to breath teacher and advocate of balance and healthy living, and very inspirational. He spoke about just the significant impact on the central nervous system, particularly in terms of fight, flight, the autonomic nervous system, the impact of breathing. And he gave us some practical insight and tools to think about how to achieve balance through breath. And he referred to water, whiskey, and coffee, different types of breathing to help acclimate and cope with various life stressors that are coming at all of us at all times, and how to use breath for different moods and struggles appropriately to help create a balance. That hard thing, that word that we don't love, balance, right? I think a lot of us like the idea of excitement and stimulation, but how do we create balance? And we really spoke about the value of being more aware and in tune with breathing as yet another tool in the toolbox to help us cope with life. So I hope you enjoy this. Lucas Rockwood in Barcelona met with us today. Thanks a lot. Hi there. I'm Adam Silberstein, Dr. Adam Silberstein here on Getting Better with Dr. Adam, and I have the distinct privilege of having Lucas Rockwood here. And I just want to say I'm a little nervous. I didn't realize who I was having here, and I'll give a little bit of a backstory. So welcome, Lucas.
Great to be here, Adam. I appreciate the invite.
Yeah, I want to give a little backstory to everybody, how this all came about. I had no idea who Lucas Rockwood was, and it was March. COVID was starting, and I was in, I'm a guy who used to be, super heavy. And if you saw me now, you'd never know, which is the miracle of my life. And with that heaviness, after 5 years, I had a surgery. I fixed some hanging skin. I also fixed a hernia. And since that time, I've had a lot of pain. And even before that, carrying the burden of all that weight was painful. And even after you lose weight. So I have had to do a lot of exercises, and I had a whole routine that COVID disrupted. And I was, my Sunday Pilates person wasn't available anymore. And all of a sudden my hip's killing. And somebody in the know, because this is not a space I know about at all, which is stretching and anything like that. Somebody in the know said, hey, I'm going to do a hip challenge. And I'm like, oh, if he's saying he's going to do a hip challenge, then I should do the same hip challenge. So I said, hey, can you send me the hip challenge? And all of a sudden I sign up for a 21-day hip challenge that was being run by Lucas Rockwood, who I'd never heard of, and I'm like, oh, he's in Barcelona. Cool. Look how he's adapted. He's got a little camera thing that he's got going there. He's so adaptive. What a creative guy. It turns out that Lucas Rockwood has been doing this for years, right? And has a whole following that I had no idea about. So I want to thank you, first of all. So when I started COVID, my hip was in agony, and I did the 21-day hip challenge, and since then have become a committed stretcher the whole time. I'm not carrying me on a stretcher like their yoga body. Today I did wrists, twists, and ankles. Every day is a different one, but I've really incorporated that, and I'm walking so much better. So I want to thank you, first of all.
Great to hear. I'm excited.
And I also want to say that in the course of getting to know you, and you're in my house every day. I have one kid at home who's still home, a 12th grader, and she wakes up in the morning. My wife and her, they hear like in through the nose, out through the mouth. It's in our living room. It's loud. I'm breathing funny. And in the course of all this, I thought it would be helpful for my daughter and I to do a little breathing practice. And this is why I actually asked you to speak. I stumbled upon this world of breathing that you're into, and I'm a clinical psychologist, and I'm like, oh, this is interesting. I love talk therapy, and I love problem solving with people, and really diving deep in terms of how people organize information and how they problem solve and clarify and interpret things based on their own historical information. And, that's the attractive part of my work to me. I do a lot of work in addiction, a lot of work with people with anxiety. And we over the years, I've been doing this for a long time. When I first started practice, there were people who were doing relaxation, right? It was a thing, and there was behavioral health, and health psychology was a thing. But more and more and more over the years, this word mindfulness has become incorporated into the basic lexicon of psychology in general. And it's a given that discussions of exercise, mind, body, spirit, and integration of mindfulness practices are a part of clinical psychology. That's a given. But what really struck me, and there's different, any facility that I've worked in will have meditation groups. There's a thing that popular in some of these groups, breath work. Different types of yoga classes are taught in treatment centers and so forth. But what really struck me about listening to your investment in the value of getting back in touch with breath was also that it was very, very specific to different experiences, and that an understanding of breathing also basic breathing informs mood states, informs how I respond and how I can prepare for different things that are coming my way, from sleep to high stress meetings to I'm about to exercise. So what I'd like to do with that big preamble is just start the discussion in a very basic way. You're talking to people the people who are listening are very invested in mental health. And I want to understand and appreciate your story and how you came to value breath.
Everyone, I guess, finds different modalities and different healing paths that work for them. And I always tell people, whatever works for you. You mentioned talk therapy. I'm a huge advocate and patient of talk therapy myself. I always just tell people, whatever's working, keep doing that. And as someone who discovered yoga, you may or may not know this, but I have a history with addiction myself. And as someone who discovered yoga, I got really interested in all things mind, body, fitness, wellness, meditation, spirituality, all those kinds of things. And I went down a lot of different rabbit holes, went through a lot of different explorations, spent time in ashrams, spent time traveling around. And I am just, I guess the way that I'm wired is I just like things to work, and I like things to make sense in my head. And a couple of words and techniques came up a lot, meditation and mindfulness specifically, continue to come up a lot, but they're very poorly defined and very vaguely practiced. And this is not to diminish the power of either of those practices, but I just found when I was talking to people, when I'd meet with students, when I meet with teachers, I found that these terms were used to describe a whole lot of practices. And it was so general that a lot of people were describing things that were clearly not meditation and not mindfulness at all, meaning their gardening became their mindfulness, and their walking their dog became their mindfulness. And gardening and walking your dog are wonderful, but it's not the same as meditation. If you've done any kind of rigorous, strict meditation, there's actually, depending on which school you're in, there's some kind of technique to it. And so when I stumbled upon breath, originally it was very similar. It was very similar to mindfulness and meditation. People talked about breath being good, breath being life, breathe slowly, breathe deeply, and everything will be good in the world. And I thought there's got to be more to it than that. And it just really appealed to my sensibilities when I started to learn about how breath actually works and how the breath affects your nervous system affects the breath. And it's one of the very few autonomic responses that we can actually take control over, which gets pretty exciting. And for anyone listening to this, I'm sure, based on your audience, I'm sure when you scroll through your news feed right now, you'll see memes on your Facebook feed or your Instagram feed that will say things like, happiness is a choice, gratitude will make your day. And those are wonderful axioms, but it's not really true. Like, a lot of people are having a bad day, and that's not a choice. It's really happening. I think that I don't think happiness is a choice, but I do think practice is a choice. And so I don't know if I can make you happy, but I know I can give you a practice that will make you feel better. I don't know if it'll make you happy, but I know it'll make you feel better. And any tool that we have in our toolbox that makes us feel better and is not leading us down a path of death and destruction like drugs and alcohol are, for me, that got me really excited. Let me put some tools in my toolkit that don't include narcotics and alcohol that can not only make me feel better, I don't want to say happy, but make me feel better, but also that can lead towards positive spirals rather than negative spirals.
Right. And I just want to add that in the world of drugs and alcohol, another big buzzword along with mindfulness, which I so agree means so much, and it's so hard to wrap my head around, hey, mindfulness could, what does it actually mean? We also have this term called dual diagnosis, which is kind of unusual, which means when I have mental health issues and I have drug and alcohol issues. So I could have a anxiety issue and a depression issue as well as a substance issue. And to me, it's like, if I have a substance issue, of course I have a mental health issue. It is a mental health issue. And so what happens, and why I really want you, I'm happy that you shared about your own experience, is you put down the substances, and it could be that, hey, welcome to your head that never shuts off, right? And welcome to the burden of having a brain and having stress that you've been able to mask some, and now welcome to getting to know what it's like to be in the human condition. And so the people that I work with are so often trapped in their heads, and I agree with you, anything in the toolbox that could be helpful. So tell us a little bit about breath and how you saw it, as you were speaking about the nervous system, and what did you stumble upon, and try to simplify it if you can. So I think a lot of us are afraid of science. So help us out there.
It's helpful if you just use the experience that we all have right now. So let's imagine that anybody listening right now goes into the grocery store, and in the grocery store, they see someone freaking out. And maybe that person's freaking out because they have a mask. Maybe they're freaking out because they don't have a mask. Maybe they're freaking out because whatever reason. And now just close your eyes and think about how that person would be breathing. You'd probably say their shoulders would be lifted, probably say short and shallow, maybe through their mouth, right? We probably could have sound off and understand what kind of mental state that person is in. Here's another test. If you don't want to go to the grocery store, scroll through your news feed with your volume down and just look at the people who show up, and just, write down on a piece of paper, I think this person feels like this, and then unmute them. And you'll be right like 99% of the time. And we're reading body language, sure. We're reading facial expressions, sure. But the surefire indication of your autonomic nervous system state, this fight or flight, arrest or digest response, is the breath. And we're very hyper aware of this. Children are aware of this. We might not have labeled it or named it or dissected it like we're doing right now, but we're very, very aware of that. And so on the one side, the overstimulated, anxious, upset person in the grocery store on your newsfeed, let's flip to the other side. Let's imagine that you're in Thailand and you walk into a wat, a temple. Let's say you go into a church, you go into a synagogue. What does the rabbi look like? What does the monk look like? What does the priest look like sitting on their meditation cushion or sitting in their chair on the chapel? They're usually a little bit slouched. Their belly is usually relaxed. And what does their breath look like? Well, their mouth is surely closed, right? You don't have to learn this. We already know this. We're just kind of defining what you already know. So what we're observing in both these cases are people's autonomic nervous system state, right? Are they in a state of fight or flight? Are they in a state of rest and digest? Are they in a state of go, 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 answer emails, get the gardening done? Are they in a state of creativity and creative problem solving and loving and relaxation? And there's two things that happen here. One is the light bulb goes on. You go, oh, wow, I do know that. And then the second thing is right away, we try to add a value judgment to this. And we try to go, fight or flight's terrible. All these anxious people are terrible. Stress is terrible. Modern world is terrible. And that's not true. All of this is about yin and yang. It's about night and day. It's about hunting and then feasting. It's about eating and then relaxing. It's about arousal and then release. This is the world, this dichotomy, this paradox. And this is why it's so hard. It's just so hard to find balance. And the quintessential middle path is taught in every spiritual tradition in the world. And it's incredibly boring to talk about, but it's the goal. We just want to try to find balance. And if you look at any time when you're not feeling well, whether it's because you're drinking too much or because you're working too much or because you're watching Fox or CNN too much, whatever it is, there's always an imbalance there. You're either too far on the yang side or too far on the inside. And this can be observed objectively with the breath. And the really interesting thing is we can override it by taking control of our breath, which we can't really do with our heart. We can't really do with other autonomic reflexes in the body. So it's a very, very interesting tool because it gives you immediate access to your nervous system. And you can have this forcing function where you change your breath and it changes the way that you feel. It's not a quick fix. It's not a panacea. It's not a cure, but it's a really effective self-soothing technique.
Interesting. All the addicts want to leave now because you use the word balance. They hate that word.
Totally.
I
hate the word too.
Yeah, they hate it.
I hate the word too. I mean, I like everything extreme. I've always said that I like everything that's bad for me. I even to this day, I walk by a bar and it smells like, a stale beer on a wooden floor. It smells good to me. I like the smell of cigarette smoke. I like everything that's bad for me. I know the feeling. I like extremes. I see people, who are running ultra marathons and look emaciated and gaunt. That looks exciting. I see people strung out on, the third night of a bender. That also looks exciting. It's, I know the mentality. It's the most boring thing to talk about that I've really tried to embrace and force myself to think about because that's really where it's at.
Right. So the intoxication of what you're describing, that super feel good, is it's so not in the balance experience that you're pitching here. It's not a jolt of feel good, but we'll work with it because I think I agree with you. From there's a foundation that's so different than the experience of high extreme intensity that so many of us crave. And so I want to just sort of take you in the direction of different presentations we'll see. So let's say somebody's really impulsive, right? And they tend to make decisions that just make bad decisions. I don't want to be not judgmental. Yes, we all make bad decisions and mistakes, but their tendency is to say, why did I do that? Why did I do that? Why am I being reckless? Why do I keep doing these things? I wish I can develop a little bit of a pause button, right? So just out of curiosity, and that's actually thinking less, not as ruminative as some of the people I work with. From a breathing standpoint, what kind of breathing would you say would be helpful to create a slowdown for an impulsive person?
So there's two practices that tend to dominate all breath work for self-soothing nervous system management. And that would be a balancing breathing practice, which is primarily determined by the rate at which you breathe. And then a really, really strong down-regulating practice, something that stimulates your parasympathetic response. And that would be a very slow breath. And so to put numbers to that, a balancing breath would take the rate, Adam, that you're breathing right now, and we'll cut it in half, but we'll keep the volume the same. So same amount of air, not going to change your oxygen or anything like that, but we'll slow down the rate. And what this is going to tell your body is Adam is safe, Adam is protected, Adam is calm. So calm, in fact, that he can breathe at half the rate and still get the same volume. You're breathing as if you're that monk, that rabbi, that priest, even despite the fact that you might be midday and you're binge eating crisps, or you're chain smoking back by the dumpster, or you're thinking of having a third or fourth beer with your lunch or whatever it is. And so that would be the first thing, a balancing practice where we'd take your average breathing rate, we'd cut it in half, we'd keep the volume the same. And so it's just a nervous system override where we're deliberately manipulating our body to tell our nervous system. It's a self-soothing technique. It's no different. It's no different than binge watching Netflix. It's no different than binge watching porn. So it's the same sort of self-soothing technique. It's just hopefully grabbing something that's going to take it in a positive spiral. And then on the far end of that, we would use something even stronger where we'd slow the breath dramatically, which takes a little bit of practice, but not much. Within a day or two, most people can get their breath down to 3 breaths per minute or less. And usually when I work with students, by the end of about 10 or 12 days, they're usually able to get down to 1 breath per minute. And so we'll do like a 10 breath pre-bed practice. And in 10 minutes, you just take 10 breaths, which for a lot of people is like 10% of their normal breathing rate. And that just has a dramatic effect on your psychology, your physiology. When you go from breathing, 10 breaths a minute to 10 breaths in 10 minutes, it's just like a big fuzzy sledgehammer bonking you over the head like a big pillow. And it just, it tells your body that you're safe, you're protected, you're calm. And at that rate, it actually just knocks you out too. It's quite superific. It makes you sleepy.
So interesting. So for somebody who's an excitement junkie, right, and constantly moving and on the, I'm looking for stim all the time, and it's getting me in trouble, right?
Yeah.
This sort of thing, what you just, especially from a balance perspective, right, but also from a super, super slow down, the opposite. Does it have lasting effects the next day? If it becomes a practice, do you see people actually rewiring?
So your nervous system responds really, really well to repetition. And this is why, let's say we take like 2 extremely well-conditioned athletes, but one of them is swinging a baseball bat and one of them's swinging a golf club. The one swinging the baseball bat is just not going to be able to swing the golf club with nearly the competence of the other one. And this is nervous system, right? Our nervous system lays down wiring based on ritual and habit and things like this. So there's just no real escape for repetition. So when you're trying to rewire, repetition is really crucial. This is why with students, like, even from our stretching program, I'm just really, really big on tiny habits that are really frequent. It just has such a better impact than the tendency to binge, just to try to like go to a meditation retreat 12 days and then I'm done and I'm going to be fixed. I'd much rather somebody spend literally 5 minutes a day breathing for a couple of months than even do a full day meditation retreat or a full day breathing retreat. You can get so much more out of it. But yeah, for sure, you can start to change your response. And so I guess one thing that's very helpful for me to understand is that, we have, our body's mostly just trying to keep us safe and help us procreate. That's mainly when I wake up in the morning, Lucas's biology is trying to keep me safe and trying to help me make babies. That's what I'm wired for. I don't know what I have all these ideas about why I'm on Earth, but I know that is my biological wiring. And sometimes in an attempt to keep me safe, my body reacts in funny ways. It hears a fight on the street out my window, or I see a news report that COVID cases here in Spain are going up, or the election is looming, less than a month away. And suddenly my body treats that signal like a physical threat. And it's not a physical threat, but suddenly I'm spun out and my cortisol levels are elevated. Blood sugar is elevated, my digestion is impaired, and my nervous system gets spun out. My breathing starts to be faster than it should be, for longer than it should be, and then I tend towards imbalance. And so the practice of breathing is really a practice of coming back to center. And so when that happens, which it will happen, and for most everybody listening, including myself, it happens pretty much throughout the day constantly. The practice is just recognizing it's happening and attempting to pull yourself back to center. And the reality is we're all doing this anyway. This is what I tell everybody. It's like you already have self-soothing tools. Just most of them are very poor choices. And so if we can get some better choices in there, you'd be happy to use those. It's not that you lack willpower. It's not that you're weak. It's not that you're broken. There's nothing wrong with you. Your body's just trying to keep you safe. And things get overwhelming. And let's face it, drugs and alcohol work. Let's face it, binge watching porn, it works. Like it lights you. If it didn't, we wouldn't do it. It's doing something. Let's see if we can find some tools that hopefully will, maybe they won't be as potent, as powerful, but maybe over time they could start to take the place. Maybe over time they can start to empower us and we can start to create these positive spirals.
So I'm hearing this. It's wonderful. This applies to everybody. "Quote unquote" mental health, whether you have a mental health diagnosis or not, you're in the human experience. But for people who need to take it down a notch, slow down, excellent. What about I guess I would imagine the same applies. What about for somebody who who says, I wish I stopped worrying. I so don't like how much I worry. I'm so not relaxed. I'm constantly feeling like the other shoe's going to drop and my world's going to collapse. And I have that type of active imagination about all those things that are falling apart that really aren't. What type of breathing do you say to that? What type of breathing technique is best practice for them? Same as the impulsive person?
Yeah, generally speaking, what'll happen is anybody who's interested in breathing, and especially if they're prone to extremes and addiction, as I am as well, when you start to get into breathing really quickly, you'll find extreme breathing practices. So I had a friend who was he would go on and off with crystal meth, and he got into yoga and he got into breathing, and right away he got into really extreme controlled hyperventilation breathing, which, you see stars, you start tingling, sometimes you convulse on the floor. And so the same trappings, I just want to make that clear, because you can find the same trappings in the mind-body world as well too. And there's plenty of people who, with all the best intentions, they find the exact same hit doing natural stuff as well too. So if you're someone who's prone to anxiety and prone to worry, whether it's obsessing about the potential future or ruminating about the past, which all of us are to some extent or another, the practice, the default practice that we come back to is what we call water breathing, which again is that rate. It's really about rate, and within that rate of practice, there's a lot of different patterns that we can use. And so the rate of inhale 4, pause, exhale 4, pause gets us to about 5 or 6 breaths per minute. And with that rate, we can start to do different patterns. We could do it supine, we could do it sitting, we could control our nostrils and these kinds of things. But at the end of the day, what we're doing is we're basically leveling the playing field. We're basically, if you're up, it'll bring you down. If you're down, it'll bring you up. I like to call it kind of an adaptogenic practice. And this is kind of our baseline. Now, of course, for almost everybody I work with too, we also include deep relaxation practices pre-bed, because that tends to be a time when we spin out with that rumination about the past or forward worry and anxiety about the future. And so we'll do a very superific practice of slowing down the breath really dramatically right before bed as a self-soothing technique as well.
And it's for those listening, you call that whiskey breath, correct? You reference water
That's
breath,
correct.
but there's also whiskey. And how did you come up with the name whiskey? I mean, I've given your history, and I think it would be interesting for people.
Yeah, every time I do a course, somebody says, "Lucas, you can't call this." I work with addicts. I was like, well, I understand that. I've drinking more whiskey than one person should in a lifetime, so I certainly understand the aversion. I don't drink anymore, and so I teach water, whiskey, and coffee. Water being balance, whiskey being deep relaxation, and coffee being stimulating. And I use these terms just because it demystifies it. It helps people understand it. And within a couple of minutes, people can wrap their head around exactly the nervous system effects of these 3 categories of breathing practices. And what you'll find when you start to read breathing books and things like this, you'll hear authors and teachers say, "This one is my favorite," or "I love this one," or "I love that one." And it's not really an appropriate way to talk about nervous system modulating practices, because I love amphetamines. I love to spin out. I love to drink 12 cups of coffee. It's not what I should be doing, And so this paradigm has been really, really helpful. That said, for those people listening who don't like these terms or who work in clinical settings where it's not appropriate, or we have therapists who work with kids and things like this, sometimes people call it water, fire, and ice. That can work as well. But water, whiskey, and coffee for me tends to work better.
So then the whiskey, and I like what you're saying, the whiskey, the real, like before bed, when you know you can get a barrage of stories in your head that are so crippling and you can't fall asleep. And even from a standpoint of, I don't know if you know this, there's an increased risk of suicide in the nighttime. Your head is so active and your brain's not on, it's not working well then. And the note to the audience, don't listen to your great ideas at 2 a.m, right? It's so the idea of at that time, maybe it's time for a deep dive into a real balance, a different type of balance, right? A real intense balance versus during the day, just the water, you can just access, put yourself in check a little bit with water breathing and whatever's going on, whatever stress, you can balance it out on a different level. When would you encourage people to, especially, people maybe who are depressed, maybe I'm thinking, who are down, when would you encourage the coffee breath?
We pretty much only recommend it in the morning and before exercise. And there are other use cases, but of all the breathing practices, it's one that has the most potential drawbacks. So we use it in Yoga Body World. We use it very, very gently. So we'll do it just for a couple of minutes, and we just use it in the morning, and we'll just use it pre-exercise to get people in a ready state to go for a run or take a yoga class or do a CrossFit WOD or whatever they're going to do. But of all the breathing practices that you would find on the internet right now, the emphasis is around coffee category practices, controlled hyperventilation. And it's because you get a buzz from it. And that's an understatement. If you do these practices for 30 or 60 minutes, people have out-of-body experiences. It's really quite profound. But for somebody who's trying to manage stress and anxiety, it's kind of the antithesis of what you'd want to do. And for somebody who gravitates towards chemical, it's very often what we're drawn to as well too. And so, like I said, it's not about what you like or don't like. I think it's more important to think about what do I need and what makes sense. But really, our core practice is training a modulated breathing pattern. So cutting your rate. You're like right now, you're probably breathing, let's say 8-12 breaths a minute, probably around 12. We'll cut that in half down to about 6. But we'll keep your volume the same. So you'll still be breathing, let's say 6 liters a minute, something like that. And that would be our core practice. Now from that, we can do quite a few different exercises, as I mentioned earlier, but that's the one we'll come back to again and again. But at night, just as you mentioned, this is a time when a lot of us suffer. And when in our modern world, most of us could really use the dampening. And so the reality is there's very few people who really need coffee category practices. So we mostly use it as kind of a nervous system reminder. So I say, hey, Lucas, it's 7 a.m. Time to wake up. Let me spend 2 minutes on the bathroom floor doing some controlled hyperventilation to get my body in a ready state for the morning. And then pre-exercise, we find a lot of people feel that the phrase that people often say is, I'm just not feeling it. It just doesn't feel right. And very often, if you're to do a little nervous system check-in, they're in a inappropriate nervous system state. They're in more of a rest and digest state of mind with their nervous system. And by doing a little bit of coffee breathing, we can encourage them, maybe not shift them immediately, but encourage their body to move over into more of a sympathetic state, a fight or flight state.
So I just want to tell you, as someone who works in the system, it's informing me. What's interesting about this discussion is, of course, we in America, there's a lot of survey work and satisfaction, customer satisfaction. So it's not surprising that the rapid breath hyperventilating is getting high ratings, which we translate, unfortunately, sometimes in good outcomes, right?
Yeah.
But that may not be what I'm hearing is it's about what's appropriate given the circumstance. And of course we'll like the intoxicating one, right? But it may not always be appropriate. Just out of curiosity, what are your thoughts on practices that aim to hold breath, breathing for a while and then hold, sort of aiming to increasingly hold breath 1 minute, 2 minutes, 3 minutes of holding your breath?
Yeah. So any kind of apnea training, the key thing to remember first and foremost is don't ever practice in the water. And that means don't practice in your bathtub, don't practice in a pool. And this sounds really obvious, but unfortunately there's people having shallow water blackouts every day. It's actually become a big problem in breathwork communities. So don't ever do that in the pool. With all of the, let's just call it land training with breath holding. And if we think about those 3 categories, water, whiskey, coffee, anytime we're doing breath holding, we're moving into a pretty profound whiskey category practice because we're dramatically slowing the breath. And in terms of physiologically, what's happening is you're boosting the CO2 that's actually in your lungs, and that has a vasodilating, bronchodilating effect and almost a sedating effect on your body. And so it can be a really effective way to calm down. And one way to think about this is like when somebody's wound up and they're spinning out, the kind of pop health advice is just take 3 deep breaths. And somebody goes, didn't work, right?
Mm-hmm.
It's kind of the worst advice. One of the best things you can do is just like take a deep breath and hold it, right? Because what we're looking for is to calm down. It's very frustrating and almost comical that our impulse reaction to self-soothing is almost always the opposite of what we should actually be doing, right? Somebody's trying to calm down. It's like, yeah, just take 5 really fast, deep breaths. It's, no, how about if you slow that breath down? And so breath holding can be a part of that. The only thing that, especially somebody new to breath work, has to keep in mind is that it's not a competition and there's no prize and nobody cares. Actually, I mean, there are some silly prizes like the Guinness Book of World Records, but that's nothing to shoot for. But I mentioned that because if you're pushing, you can have the opposite effect. So if you're attempting to relieve anxiety by doing prolonged breath holds, that could potentially create anxiety. But yes, as we move into whiskey category practices, we slow the breath and we even have cessation of the breath for longer periods. 1 breath per minute is very attainable for students after just, like I said, 7 to 14 days of practice.
Mm-hmm.
And even down to 1 breath every 2 minutes is also very attainable for most people, which I know for people listening, it's like, that's impossible. But really, you can get a hold of your nervous system that quickly. And this is not even a strain on your body. Your blood oxygen levels won't drop at all. It'll have a very, very relaxing effect on your body. It's very healthful, but it does take a little bit of practice, but nothing like what it takes to even become mildly competent in meditation, which is why I get so excited about breathwork. It's just so much more accessible to your average person.
I know we're running out of time, but I want to say that just a quick note on people who are having panic symptoms, what breath, when they really have this shortness of breath and increased heart rate, and they're really in that fight flight mode, what breath do you see working the best from your seat anecdotally for people like that?
The practice that people want to make part of their daily life is a basic 4-4 balanced breath, which would fall under the water category. And the way I like to think about it is, let's imagine it's midday on a Friday and you're spinning out with stress and you walk into a bar and they have just 3 beverages. 1 is water, 1 is whiskey, 1 is coffee. If you're being smart, if you're being your best self, if you're Lucas on his best day on Friday, which beverage do you grab? You grab the water, right? The water is what we want. So the water category breathing, how that works is we inhale 1, 2, 3, 4. Exhale 4, 3, 2, 1. And you count on your fingers and you do 10 rounds. Just takes a couple of minutes. And this is the one you want to come back to. And this is particularly practical because you breathe through your nose, obviously, but you don't need to be sitting on a meditation cushion. You don't need to lie down on your back. It's safe in any setting. You could do this standing in the store, at the grocery store when somebody's freaking out. You can do this as you're quietly waiting for your turn to present at a meeting with your PowerPoint clicker or whatever you're doing. And so this is one you can incorporate. And this is the one you really want to train. And a lot of people don't realize this, but a yoga class done correctly, which unfortunately breathing's been kind of lost in modern, or well, I should say contemporary yoga. It's just in the past couple of years, people forgot about it. But a yoga class done properly actually includes breath throughout the entire thing. And again, what we're doing is entrainment, right? So that when we have a stressful feeling, like a back bend, like a deep hip stretch, like the angry person in the grocery store, like the boss telling you the deadline is today at 8 p.m., instead of buzzing, spinning out, breathing high up into our chest and creating a stress response, hopefully we can self-soothe with that inhale 1, 2, 3, 4. There's a pause at the top. And then we exhale 4, 3, 2, 1. And of course, there's so much more that you can do with breathing. And you can spend years literally studying. And of course, I've done that and other teachers like to do that. But you don't have to. You can get all the benefits by keeping things really, really simple. And once you understand the fundamentals, and again, I like the bar analogy. You walk into the bar, of course, there's a lot of different cocktails and a lot of different, frappuccino, mocha, this and that. But really what we have is water, whiskey, and coffee. That's what we have. We can balance our nervous system. We can crank it up or we can downshift. And when you think of things that simply, it really becomes a powerful tool for self-care.
In our closing here, I know that you have a history of, and you're sober, and you've really had a journey. I read all about you in terms of where you've been and where you've arrived and are still going. What message do you have for people who are in early recovery and are just out of their minds?
The only thing that I has really helped me is to understand what I chatted about earlier, to understand that guilt and shame and self-doubt and this idea that you're broken or there's something wrong with you, I just don't find any of that to be helpful or even true. When I really wrap my head around this idea that my body wants me to live, not only does it want me to live, it wants me to procreate, and this is why I am here, and it's just getting mixed up. It was just really helpful, especially when you have slip-ups, which everybody does. You're feeling great and everything's going good, and then suddenly you're spun out doing whatever your negative behavior is. Just understand, this is just my body doing its best. There's nothing more to it than that. And it doesn't make me a bad person, doesn't make me broken, doesn't make me faulty. And my goal is just to hopefully put my body and my mind in a place where I can make more positive, healthful choices. But I at least would, get in these just self-deprecating negative spirals where I thought something was wrong with me and a chemical imbalance and I'm wired differently. And who knows, maybe there's some truth to that. But how I know that I'm wired and how I know that 99% of the world is wired is to survive and procreate. And then what happens? Well, there's elections and there's COVID and there's hurricanes and there's stuff that really spins us out. And sometimes these modern tools that we have available, whether it's cannabis or alcohol, whether it's, methamphetamine, whatever it is, these things, they sometimes can be a substitute for what we really need, which is something balancing.
Keeping it simple, Lucas Rockwood. I'm very, very, very much back to basics of the basics of life. I love the message. I so thank you for sharing with us. I'm excited to share this information, and great to have you. You can reach Lucas Rockwood at yogabody.com or yogateacherscollege.com. Is that right?
That's correct.
And there's a plethora of resources available through Lucas Rockwood. Thank you so much for sharing with us today.
I appreciate the invite, Adam, and I hope to stay in touch for the future.
Me too. Take care.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there's an emergency, it is strongly recommended you seek treatment at your nearest emergency room.